Hi, I'm Kristen Malecki. It's great to be here with you today and support the Lake County and Grand Foundation in helping you help yourselves by providing more information about COVID-19 vaccines. I have been a proud member of the Grand family since I was born. My uncle Mark Recklane is now the owner of the Grand Company, and my cousin Megan supports the Grand Foundation. The Grand Foundation honors the spirit and generosity of our grandparents who dedicated their lives to giving back. I also happen to be an epidemiologist. I became an epidemiologist because I care about people and people's health. I have a doctorate degree, and my goal is to help inform you so you can make the best decision for you and your family about the COVID-19 vaccine. There's lots of complicated information out there, so let's get started. A key question about the COVID-19 vaccines is, do they really work, and can they help us get back to normal? And the bottom line is yes, they work. The simple answer is yes, the COVID-19 vaccines work. The COVID-19 vaccines help your body build up the tools it needs to fight the virus. So the next time you're exposed, you won't get as sick, which means that even if you are exposed to the virus, your body will have the tools after you're vaccinated to fight it off, so you'll either get slightly less sick or not sick at all. You hear a lot about people telling you that the COVID-19 vaccine is effective. But what does that really mean? Well, what it really means is the COVID-19 vaccine works. It means that out of 100 people who get vaccinated, at least 95% of them will never get sick again after exposure to the COVID-19 vaccine. And it means another 4 or 5 individuals may get a little bit sick, but they are 100% effective in helping people to get from getting severely sick or even dying, which means they're 100% effective, which means they work for everybody. Another question people have all the time is, can the COVID-19 vaccine make me sick with COVID-19? And the simple answer is no. The COVID-19 vaccine is made so that your body can recognize the different pieces of the vaccine and help your body fight off those different pieces of vaccine by creating antibodies without actually making you sick with the COVID-19 virus. In the past, other vaccines are made from the actual live virus, which then makes people sick or can make people sick. What they found with the COVID-19 vaccine, which isn't made out of live virus, is that some people have side effects for a day or two after they get the COVID-19 vaccine. That's just your body building up the immune system, but it doesn't mean that you're actually sick with COVID-19. You may have a slight allergic reaction to the COVID-19, but very, very, very few people have had that allergic reaction. And some people might feel a little bit of irritation in their shoulder next to where the shot is, but that's a shot. Somebody put something in your arm, so it might hurt a little bit. But long term, your body will have the tools that it needs to fight off the vaccine, and you will not get sick with the COVID-19 virus. This also means that the COVID-19 vaccine creates cells in your body to fight the infection, but it won't create cells in your body that are the infection itself. So you will not test positive on the COVID-19 vaccine after getting the COVID-19 vaccine unless you were infected with the virus right around the same time that you got vaccinated with the virus. You might also be wondering if the vaccines are really safe. If they were made so fast, how can they be safe? And that's also a great question. First, the new vaccines, while they seem brand new, they really aren't new. They're based on over 50 years of scientific research around how our immune system works and can fight off viruses. The vaccine technology was already available. Scientists just needed to apply it to the new COVID virus. What was sped up is they sped up the paperwork and money, but they didn't speed up the science. The vaccine was tested on over 75,000 volunteers. The federal government would not release a vaccine unless they knew it was safe for the public, and that is what they did. Another question people typically have is, especially women like myself, what happens if I want to have a baby someday? Will getting the COVID-19 make me hurt me or hurt my baby or ruin the chances of me having a baby? And that is an excellent question. And while we'll never know 100%, scientists do believe that the vaccine is safe for you and for your children. They do say you should recommend or you should talk to your healthcare provider before getting a vaccine if you happen to be pregnant. But if you're just thinking about having a child, the best way to protect you and protect your future child is to get the COVID-19 vaccine. Finally, people have a lot of questions about how long will protection last. Again, that's a really good question. We don't really know. It's a little too early to tell, but scientists are working on finding out more information. Most scientists and doctors believe that the vaccines will create an immunity that lasts at least 3 to 5 months, or at least long enough to help us get the COVID-19 situation under control. Antibodies from the actual COVID-19 virus are found in people's bodies 3 to 5 and sometimes up to 6 to 9 months after infection too. But again, it's still too early to tell. It may be a while before we really understand how long the protection from the vaccines will last in our body. But you should still get vaccinated. It will help you and it will help others. I agree. This is all very complicated. And there's lots of resources that are out there. Some of them that I trust the most are our local health departments. If you're living in Lake County, you can go to the Lake County Health Department and you can register to get your COVID-19 vaccine there. They also have lots of great information to help you better understand what's going on. Another great resource is the Washington State Health Department. They put together this fantastic 1-minute video that you can access on YouTube on how the COVID-19 vaccine works in your body. I highly recommend it. Another great place to get new information is the Centers for Disease Control and Prevention. There are many, many dedicated scientists who are there to protect you and protect your health, and they have these guidelines out there. And remember, vaccines are one of the tools we have to fight the pandemic. Staying 6 feet apart and wearing masks are also really, really important for all of us in keeping the fight against COVID-19, protecting you and protecting your family from this deadly virus. So when the time is right, I really encourage you to sign up and get vaccinated today. Many of you watching this may already be eligible. Others may need to wait a little bit of time and be patient. You can, there are many resources within your community, but you can also, if you live in Lake County, you can go to lakecountyhealth.org and get signed up for a vaccine today. But remember, please wear your mask, wash your hands, keep a safe distance, and we can do this together. Thanks and have a great day.